Good evening to everyone and welcome to 16th. What is in the today? 16th NEETPG grant test. You took all 16? Good. And every day we have a test and discussion, and totally 70 grant tests, 14,000 MCQs should be good enough to equip you what the examiner wants in the tomorrow's NEETPG exam. So, with that preamble, let's make the great beginning. Thanks to around 8 to 10 students who are all online. Please inform your friends. So, doctor, what is the act that prevents, which are the structure that prevents clavicular dislocation at the acromioclavicular? Oh, acromioclavicular joint dislocation, doctor. It is the acromioclavicular ligament. 1 minute. I'll just. Where is that sound setting is there? Can you just check? But otherwise, why it should be there? Okay. No, sir. So very good to see Swati, Sai, Sandeep, and many more who are all online. Now, doctor, a 54-year-old female with chronic pelvic pain to avoid excessive bleeding during surgery, what you should ligate. So you should remember it is suspensory ligament. The nerves and the vessels which are supplying the ovary are all delivered through the suspensory ligament. 7-year-old boy, he complains of pain and numbness of the dorsum of the right foot and cannot dorsiflex his right ankle. So, what is your answer? Should. It is fibular head because very close to fibular head, which nerve passes, doctor? Common peroneal nerve passes very close. 52-year-old male presents with painless mass in his groin, several hard lymph nodes in the right inguinal area. The lymph node biopsy reveals malignant cells. From where are they originated? So, right inguinal area means it is all what superficial inguinal lymph nodes. So, all the skin from the umbilicus down, including the anus up to dentate and pectinate line, they're all superficial inguinal lymph node, excluding the posterior calf. So, lymph from the prostrate drains into interiliac lymph nodes. Lymph node that drain the testis follow the path from testis to abdominal aortic lymph nodes. Lymph node from the superior portion of the bladder drains into extrailiac lymph nodes. Mano. Full. Good. Good to see 13 online classmates. Please inform your friends. Then lymph from the inferior portion of the bladder drains into internal iliac group of lymph nodes. Sigmoid colon drains into inferior mesenteric lymph nodes. All these things you need to be doubly sure about. Now, the X-ray reveals a fracture in the middle third of the right clavicle. So why the medial end of the fractured clavicle is displaced upward? Because the sternocleidomastoid is what you need to remember. Sternocleidomastoid pulls it up. Sebaceous glands are holocrine glands, eccrine glands. These are present in the skin throughout the body except the lips and glans penis. Mitocrine glands secrete a watery rich secretions which are rich in sodium and chloride, that is in sweat, directly onto the skin surface. 34-year-old male with motor accident, and he received several units of RBCs, tingling sensation of the toes. Serum calcium is 7.2. So what is the main reason? Obviously, transfused blood is having citrate, which will cause the chelation of the calcium, leading to hypocalcemia. 23-year-old male, 5 miles, what do you expect to increase at the peak of his exercise? Carbon dioxide content in the mixed venous blood. 23-year-old complains of occasional dyspnea and wheezing. He has no history of allergy, atopic dermatitis is there. And spirometry findings are normal. Which is the best drug to use for provocation? Methacholine can be used for provocation. Diksha, you can keep this open because Sunday nobody is there, no? Little ventilation, cross ventilation will be there. Very good. Can the online students can punch? Whether the voice is loud and clear for all of you, doctor? Please punch. Then low-dose morphine injected into epidural space produce long-lasting analgesia. So how does it basically act? It increases potassium efflux out of the cell. That is the direct post-synaptic action of the drug on the spinal nerve. So there are mu receptors which are G protein linked receptors. Binding of morphine to these mu receptors lead to activation of the potassium conductance, and potassium efflux increases, and that lead to hyperpolarization of postsynaptic neurons that is responsible for blocking the transmission of the pain. That is how morphine basically acts. Which is a precursor of NAD coenzyme? Easy question. Tryptophan. That's the reason if tryptophan is not there, niacin is not there, and that lead to pellagra. Then 34-year-old hyperglycemia, gestational diabetes, which enzyme activity is decreased? What did I give? What enzymes increase, decrease in starvation feeding? And now what is your answer? Gestational hyperglycemia is there. Should. Huh? Glucokinase, beautiful. Glucokinase is a sensor of the glucose in the pancreatic beta cell. Any inactivating mutation of this enzyme lead to mild hyperglycemia that can exacerbated by the pregnancy. Once more, in the notes I gave you, glucokinase versus hexokinase. There is a beautiful Lagatar discussion is there. Please kindly revise that. So we are almost testing in our score app. It came very beautiful. If you type glucokinase, it will bring all the paragraphs. It will bring all MCQs related to the glucokinase. And whatever search you made, it will store also. So next time, whenever you want, you can just click your old searches and then it will bring back both the things. So that way preparation become easier. Nice to see Chava, Bharadwaj, Shobia, Afroz, and many more who are all online. Now, what is wrong statement about this? So UGA does not signify the stop codon in mitochondrial DNA. It does that in nuclear DNA. So in mitochondrial DNA, UGA codes for tryptophan. That's the point. You can't help it. Now, which vitamin supplements in measles? Vitamin A. Heart disease is niacin. Niacin deficiency due to excessive loss of dietary tryptophan is what you need to remember. Now, right, correct? 1 minute, 1 minute. They have put some settings. Just running through the. Which question we are at? 15, huh? 16, okay. So, pulmonary function testing to show which patient is having chronic stable asthma is obviously asthma is a obstructive lung disease. That's the reason residual volume will increase. 18-year-old man with swollen lymph nodes in the neck for 2 weeks, 5 kg weight loss. Huh? What is that? Refer to the surgeon for lymph node biopsy. Any lymph node that does not respond to usual treatment, like 2 courses of antibiotics, should always raise a suspicion, is the point of interest here. 57-year-old postmenopausal woman, stage 2 PR positive breast cancer. So, initiation of hormonal treatment with tamoxifen. What is the duration? 5 years. Optimal duration with tamoxifen therapy is 5 years. 85-year-old found to have esophageal web. So, esophageal bouginage is the one which is used. Esophageal web is, you mean to say it does not lead to obstruction? So before doing, it's a gullet. So doing any invasive surgery is not acceptable, right? We'll try to be non-invasive as much as possible. Hence, we do the bouginage. So typically, where is web located? In the upper third of the esophagus. And iron supplementation need to be done in addition to fracturing the web with a esophageal boogie. Now, which will exacerbate reflux esophagitis, doctor? Theophylline. Theophylline is an alpha-adrenergic bronchodilator. It is a smooth muscle relaxing agent and exacerbates the reflex esophagitis. 24-year-old with right lower quadrant pain, McBurney point means even a baby says answer, appendicitis. 17-year-old woman who is having 2 plus proteinuria, BP is 145/90. So what do you expect in the kidney? Huh? What is your answer? ప్రిఎక్లాంసియాలో కిడ్నీలో ఏముంటుంది? గెస్ కొట్టండి. గ్లోమెరులర్ క్యాపిలరీ ఎండోథీలియోసిస్. Preeclampsia में the hallmark, pathological hallmark is glomerular capillary endotheliosis. ఎందుకు వస్తుంది ఏఎన్ఏ పాజిటివ్? 25-year-old with clear rhinorrhea, ocular and nasal pruritus, nasal congestion, sneezing. Which test is most useful in diagnosis to trigger immediate hypersensitivity? Puncture skin test will help. So even though eosinophils are usually identified in nasal secretion from patients with allergic rhinitis, they are also detected in non-allergic conditions also. So radio allergosorbent test, RAST, is the one which has got a very good accuracy, but it is more expensive. 60-year-old woman with complaints of headache, MRI of the head performed. There's a microadenoma of the pituitary. So what is a hormone that get elevated? Most of them are prolactinomas. 29-year-old suddenly develops left hemiparesis with DVT in her right leg 3 years ago. What condition most likely can cause? Lupus anticoagulant. Huh? ఏది కాదు? Atrial fibrillation. Atrial fibrillation. ఇక్కడ అడుగుతుంది డివిటీ ఎందుకు వచ్చి అది ఎందుకు ఎంబలైజ్ అయిందని అడుగుతున్నాం. He developed a hemiparesis and she earlier experienced DVT. Now what can be responsible for her DVT? It's one of the prothrombotic state. That is lupus anticoagulant. So non-valvular atrial fibrillation causes stroke in elderly, but there is no reason to suspect rhythm disturbance in this given patient. Earlier he didn't have atrial fibrillation, no. A middle-aged man, 5 centimeter erythematous scaling plaque with central clearing, KOH preparation from a scraping of the scale show branched hyphae. What is your answer? Simple. Tinea corporis. I told you, one MCQ definitely on dermatophyte infections. Manu, did you give coffee? Manu? Coffee. 62-year-old with dyspnea began about 3 weeks ago, progressed. Then there is a JV distension, jugular vein. Central venous pressure is 10. S3 gallop means LV failure. Bibasilar rolls are there. Come on, what is your diagnosis? S3 undante heart failure. Congestive heart failure, what helps to establish a therapy? Echo. Very good. Simple questions. The criteria that need to be present for at least 6 weeks to diagnose rheumatoid arthritis include coffee, Cooper Coffee, British Airways, right? So we are not a low cost airline. We are like Jet Airways and Lufthansa. We get coffee free if you come to class. Good. Uh, very nice to see Dr. Wajid. Uh, I'm so happy to find you teaching with some zeal and enthusiasm as you taught me in 2019. Now I did MS General Surgery from All India, AFMC. I'm now a laparoscopic surgeon. You taught us till evening before NEETPG exam. I still remember 2019 Kal exam bole to we had a session that day night also. Uh, Sir, you deserve Bharat Ratna. Ammo. I can already you made me. So before this, I failed 10 times in NEET PG. Vinisha, you should break this record. So 11th time with your guidance, I qualified and went to AFMC, right? So thank you, Dr. Vajay. You used to call me commandant. Ah, I remembered. He worked for army. Correct, correct. In lot of videos, we used to say, Commander, what is your commandant? What is your answer? Yeah. Thank you, Dr. Vajid. You made my evening. I'm so proud to know that you have done laparoscopic surgery, and I wish whenever I'm in Pune, I'll definitely love to catch up with you, maybe on a free scotch served by the defense. So, good. So, one day, Diksha, you need to give this feedback. Manu, you close him, the sound system. So, doctor, according to the American College of Rheumatology, the criteria that need to be present for at least 6 weeks is rheumatoid nodules. So, morning stiffness, arthritis with 3 or more joints, arthritis of hand joints with swelling, symmetrical arthritis, positive serum rheumatoid factor, they're all the important criteria in the American rheumatology. 25-year-old while climbing stairs on physical examination, there is a systolic ejection murmur that radiates to the neck. And what is carotid upstroke getting slow called? Pulsus et tardus. Where do you find this? Oi! భరత్ ఇట్లాంటి తప్పు పెడితే మా వైజాగ్ ఆంధ్ర పిల్లలు ఊరుకోరు, కట్ చేసి పడేసి వెళ్ళిపోతారు మిమ్మల్ని మీ ముందుకి, రైట్? సో మనం now what is common to both emphysematous and bronchitic type of COPD. Dyspnea is common to both of them. Pulmonary function data in a patient of idiopathic pulmonary fibrosis most likely to show it is a restrictive lung disease. That's the reason it will show low lung volume. Once more, I want to re-emphasize COPD, obstructive versus restrictive lung disease, spirometry differences. What happens to FEV1, what happens to FVC, everything you need to master, doctor, for the tomorrow's NEETPG. 64-year-old man with hypertension, diabetes, hemoglobin is 9, MCV is 74, microcytic anemia. So what is the next best step for patient's anemia? Always any elderly person presenting with iron deficiency anemia, you need to evaluate for underlying colorectal cancer. So that is the reason colonoscopy is must, because commonly it is the occult blood loss that lead to microcytic anemia in elderly person. 54-year-old first screening colonoscopy. Fungating mass is seen in sigmoid. It shows the lesion has penetrated muscularis propria. 3 regional lymph nodes are positive for adenocarcinoma. What is the chance for him to get cured? Which form of therapy? Adjuvant chemotherapy. So, typically, whenever anybody has a lymph node metastasis positive, any T or N1 or N2 or M0 adenocarcinoma of the colon, they all require adjuvant chemotherapy is the carry home message. All right, doctor. So I told you, no, there is no NEETPG paper without colorectal cancer. You have to make it a point that you do the review. Now, doctor. 26-year-old woman presents after return of her pap smear. It showed a low-grade squamous intraepithelial lesion, LSIL. What is your answer? Miru? Pap smear 2 years ago was negative. The most appropriate next step, biopsy. Cervical cancer mortality is very preventable. If the pap smear returns low-grade squamous intraepithelial lesion, then a punch biopsy is required to diagnose CIN or invasive carcinoma. If the biopsy shows CIN1, then it will resolve and does not require treatment. Then you need to do a follow-up treatment of a repeat pap smear in 4 to 6 months is what you need to remember. Whereas CIN2 and CIN3, they are treated with ablative therapy, either cryotherapy or laser. If the punch biopsy returns showing invasive cancer, then staging is done and the patient is treated with hysterectomy or radiation or both of them. If the biopsy did not make the stage of the pre-malignancy, clear, then conization is indicated that time. So this protocol, repeatedly, every entrance, they keep on asking one question on this protocol, doctor, what do you want to do? So good to see Trilok, Chandra and many more. Keep punching your answers, doctor. That way it becomes more interesting, right? Mention the question number and punch your answers. 52-year-old woman from Mumbai, smoker with the history of the Hodgkin's disease, at the age of 29, treated with chest radiation, developed squamous cell carcinoma of the lung. The staging shows 2.5 centimeters, solidly lesion in the left upper lobe. Her FEV1, FVC are 70%. So how do you want to treat? Lobectomy. So always remember, treatment for stage 1 lung cancer is surgical resection. That can be lobectomy or a wedge resection of the involved lung segment. Surgical resection for stage 1 or 2 non-small cell lung cancer. Generally, small cell lung cancer distributes diffusely throughout the body by the time you detect only. Understand? So if it is a non-small cell lung cancer, it is curative. Neither chemotherapy alone nor concurrent chemoradiation therapy is good for a young, otherwise healthy patient who is in a early stage lung cancer. That is a carry home message. 63-year-old man diagnosed with prostate carcinoma, elevated PSA. He is currently asymptomatic. The first test to order in staging for prostate cancer is bone scan. All right. So these are all purely standard clinical practices in each of this malignancy, right? So you need to be very sure, reflexly answer. Guesswork will not help you in the exam, right? So 51-year-old man with recurrent peptic ulcer has fasting gastrin level of 1000. Presumptive diagnosis of Zollinger-Ellison. What is the most common site of origin? Gastrinoma arises from pancreas. So there is a gastrinoma triangle. తెలుసు కదా? అదే మీరు మరి భలే ఉన్నారండి. గ్యాస్ట్రినోమా ట్రయాంగిల్. మీరు గ్యాస్ట్రినోమా ట్రయాంగిల్. Coffee తాగారా? Is it hot only, right? 74-year-old male smoker with the history of coronary artery disease. What is the most common vulnerable area for ischemia? Splenic flexure. 52-year-old, 3 fecal occult stool test cards with one window testing positive for occult blood. What is the best step? Colonoscopy. Who are having positive fecal occult blood. Recurrent nausea, occasional episodes of diarrhea alternating with constipation. And there is a markedly delayed gastric emptying. No 48-year-old women, delayed gastric emptying, gastroparesis. Diabetes mellitus కాదప్పా, insipidus. Mellitus insipidus ఒకటే కాదు వినిషా. So gastroparesis is a disorder of gastric emptying. It is most frequently associated with greater than 10-year history of type 1 diabetes mellitus. అప్పుడు వాళ్ళకి autonomic neuropathy develop అయ్యి, because of that there is a gastroparesis. So we use prokinetic drugs like domperidone, erythromycin, cisapride are used to treat gastroparesis. 50-year-old undergoing screening. Scleroderma. ఇక డయాబెటీస్ ఇన్సిపిడస్ కదా, మెలిటస్ అనలే. మీరు ఇంట్లో చేసి రావాలి, ఇక్కడికి వచ్చి అనాలిసిస్ చేస్తే కష్టం. శతాబ్ది ఎక్స్ప్రెస్ స్లో అయిపోతుంది. 40 నిమిషాలు 45 క్వశ్చన్లు, నాట్ బ్యాడ్. సో ఈ రేట్లో మనము అమ్మో 3 గంటలు పడుతుంది, ఇంకా ఫాస్ట్ ఉరకాలి. 50-year-old associated symptoms of single small colonic polyp. The greatest risk of cancer with the individual polyp is when they are more than 2 centimeters in diameter. If they are villous instead of tubular, if they are sessile rather than pedunculated, they are all the risk factors for a polyp to become cancer. What is the predisposing factor for adenocarcinoma, Barrett's esophagus? 35-year-old ALT elevated polyarthritis nodosa is associated with which hepatitis? Vasculitis అదినవా? నేను రోజు నేను వెంట పెడతా. Vasculitis చదవాలే అప్పా. Polyarthritis nodosa is associated with hepatitis B. HBV serological positivity ఉంటుంది polyarthritis nodosa patients లా. Right? Wegener, Churg-Strauss, polyarthritis nodosa, microscopic polyangiitis, Takayasu arthritis, Kawasaki disease. ఇవన్నీ they are the gods of NEETPG entrance exam. If you don't worship them, no, they will come and catch you in the exam hall. Right, doctor? So, fish oil can prevent or slow down the loss of renal function in वेजनस ग्रैन्युलोमेटासिस. मछली खाओ, वेजनर को दूर करो. मछली खाओ, वेज को दूर करो. Which artery to be saved while operating common bile duct structure? Right hepatic artery. Delta bilirubin is bound to albumin. So delta fraction, delta bilirubin. So conjugate bilirubin that is covalently linked to albumin. So immediate surgery in penetrating neck injury is for subcutaneous emphysema. So in the neck injuries, please don't forget, doctor, in surgery I discussed zone 1, zone 2, zone 3. So what are the very important hard signs of neck injury? Any pulsatile bleeding, expanding hematoma, unilateral extremity pulse deficit, wound bubbling, airway compromise, etc., etc. So what is this structure, doctor? Exotrophy of bladder. Then about breast cancer. Medullary carcinoma is known to have a favorable prognosis, even though it is poorly differentiated with a high nuclear grading, still it is having a good prognosis. After surgery with achalasia cardia, patient become completely symptom free. In the recurrence, the recurrence but completely symptom free after surgery and a curative effect of surgery and that credit goes to achalasia. Indu kaagudanu em ledhu endukante vallu they don't become symptom free. Treatment of anal cancer stage 2, concurrent chemoradiation. So you should know, stage 1 you do local excision plus anal margin. 2 to 3 radiation plus chemotherapy, chemoradiotherapy. Stage flow is cisplatin based chemotherapy with or without radiation. Colorectal cancer, anal cancer, compulsory. पैनक्रियाटिकोडियोडिनेक्टमी इसको क्या सर्जरी बोलते बेटा? दीक्षा, विपल्स. विपल्स. सो विपल में क्या क्या निकाल दोगे? Complete removal of pancreatic duct, pancreatic and hepatoduodenal ligament lymph nodes. You will also remove the duodenum with a short segment of the proximal jejunum and the distal half to 2/3 of the stomach. Stomach को काट लेते, duodenum को काटोगे, and the right half of the greater omentum also. Understand? So that is called Koshk-Whipple's procedure or Whipple's procedure simply. So there are certain scenarios, contraindications for doing Whipple's. Any metastatic disease to the abdominal cavity or a nearby organ, as what you can see here, secondaries to peritoneum, becomes a contraindication for doing such a Whipple. Maggot which you use for wound debridement is green bottle fly. You will leave the maggot, it will eat all the flesh, and that's how you do wound debridement. Treatment for acute bleeding, banding, sclerotherapy and surgery, acute key. Long-term prophylactically, you want to bring down the esophageal variceal pressure. You use Nadolol, like beta blockers. Person was found unconscious, small hemorrhages on corpus callosum, classical case of axonal injury, diffuse axonal injury. About chronic subdural hemorrhage, presents weeks after a trivial injury. A lot of times the old man doesn't remember what happened and he starts developing forgetfulness. He can be completely asymptomatic. You need to put a subdural drain. If you use a subdural drain, With a decrease, then there is a decreased need for repeat surgery. A RTA patient with multiple fractures means immediately you'll jump to multiple petechiae on the front of chest to altered sensorium. वो वर्ड्स देखते ही जंप करके फैट एम्बोलिज्म ले लो. अब्बा मल्ला ఈ స్కోరింగ్ సిస్టంలో దిమాగ్ ఖరాబ్ करते ये पूरा. Swati is saying, sir, 55th question, all except, sir. 55, ఏంటప్పా అది? Except beta blockers. Beta blocker is not used for acute, Swati. It is used for prophylactically. It is used for prevention. Except in a word? అంటే నేను మీతో కలిసి ఇప్పుడు క్వశ్చన్లు చూసి చదివితే అది కరెక్ట్ కాదు కదా, నేను ముందరే చదువుకుని వచ్చా. You think Murali Bharadwaj is teaching since past 23 years, he will know everything. No. I take 3 hours to set paper, 2 hours to prepare, and 3 hours to deliver. So 9 hours of my 49-year-old life is dedicated for Diksha. आपके अनुरोध पे, ठीक है? तो we had a wonderful late night party yesterday till 2 o'clock. We had been drinking like fish. So all others gone to sleep. We played a lot of rummy with all the wonderful Cuban cigars. So when in the middle of the night full moon is there, I gently apologized my girl and said, I need to sit like I washed the face, took a green tea, and then sat up to morning 5:30 to prepare the paper. So there who is visible to me is Diksha's face. क्यों sir? 70 papers promise किया, एक कम हुए तो भी फीस वापस. मुझे सीट नहीं आए तो आपका जिम्मेदारी होता. Right? Good. So what I'm trying to tell is, at 50 years, see, I don't like to be called 50. I'm not accepting 50. 49, okay? At 49, if I can read 9 hours to prepare for this daily mock test at the age of sweet 24. When I was 24, if I remember, I used to be work almost 21 hours a day, 2 days without sleep also. That kind of level of energy I used to have. So anyway, it's all you guys who give me energy. So doctor, so every day we have once more to all our online students, I love to tell you, doctor, every day next any రోజులు 54 days, यमधर्मराज नजदीक हो रहा है. तो time is just relative measure, doctor. Some people say time doesn't exist as a dimension. It's a dimension created by us. So next 54 days, कृपया रोज 10 बजे होते ही स्कोर ऐप में नया टेस्ट आएगा, नीट पीजी ग्रैंड टेस्ट. फटाफट 3 घंटे में खत्म करो, और दोपहर या शाम को मैं आऊंगा, आपके साथ 3 घंटे बैठ के डिस्कशन करेंगे. उसके बाद समझ लो क्या क्या टॉपिक्स में आप क्लीन बोल्ड हो रहे हो. So those shots you need to practice, those topics you need to practice. We are introducing the feature called search in the score app. If you say Parkinsonism, all the slides where Parkinsonism is there, they will all come and sit before you. All MCQs where that buzzword is there, they will all come. So just solve those MCQs, solve those this thing, and become high yield buzzwords. You need to know where you need to repair yourself, right? That's one new feature we are introducing in Score app. Today only download the Score app, doctor. And suppose if anybody of you are looking forward for subscribing, please connect with this WhatsApp joining link, WhatsApp group link I'm posting in the this thing. So you will land with us. Somebody will reach out to you and help you to get subscribed, right? So there are 1200 pages notes, 600 hours of video, 40,000 MCQ subject wise, topic wise, along with 70 full scale grant tests and everyday live discussion. So this is what we offer on the Score app. So please do subscribe and enjoy your preparation. Still 50 days is a wonderful time, doctor. Let me tell you. Q SOFA score. So fundamentally, whenever there is, what is Q SOFA? It's called quick SOFA, is a bedside to identify those patients who are having sepsis, what is their outcome going to be in ICU. So systolic BP less than 100, respiratory rate more than 20, and Glasgow coma scale less than 14. Finish up बेटे. Minimum Glasgow कितना होगा? 0 नहीं 3 होगा. 0 नहीं 3 होगा. Very good. So why it's called SOFA? Quick sequential organ failure assessment score. That's the reason. So once more, tomorrow's NEETPG, suddenly when MCQ comes on SOFA, you will remember me this Sunday evening. We had a discussion. Don't accuse me. Paper was out there. So Trilok, Sandeep, Divakar, everybody. Also, please mention question number and paste your answer. We love to see that. What is not true for diagnosis of gas gangrene? Giving hyperbaric oxygen is a controversial treatment in gas gangrene. About pulmonary contusion, a lot of times contusions in the lung will recover on their own. They don't need intubation. That's a point of interest here. Barrett's esophagus, there is an overproduction of epidermal growth factor in saliva, decreased esophageal motility, and duodenogastric reflux. They're all responsible. Right? Then gallbladder carcinoma is M1 stage when which lymph node is involved? Aortic group of lymph node. Mala, this is too much, no? Already knowing gallbladder cancer, usme staging, usme which is M1. Don't make wild guess in exam. ऐसा क्वेश्चन है तो वो रूम अंदर गए तो HIV मिल जाएगा. So be careful to not get seduced by the examiner to make you feel that you know everything on the planet Earth. Nobody will know everything in the planet Earth. To know that what I don't know is the secret of cracking top rank in NEETPG. Remember that. आपको कम से कम आपको समझ में होना है मुझे क्या आता क्या नहीं आता. Panda sign means raccoon signs. Where do you see? Bilateral. It is a sign of anterior cranial fossa fracture. About retained antral syndrome, what is except? So it is seen after Billroth 2. Technetium scan is used for diagnosis. Calcium provocation test was negative. अच्छा पहला बताओ, what is retained antral sign? So whenever you do Billroth type 2, then some part of the antral tissue remains. So that retained antrum typically after gastrectomy will start producing the excessive acid, which lead to once more peptic ulcer features. That's called post-gastrectomy syndrome, is what you need to remember. So, wandering spleen. There is an infarction, torsion encapsulated with a long vascular pedicle, and the chronic torsion leads to splenomegaly. So this is how the spleen reached here. This is the stomach. इसका जगह कहाँ होना है? यहाँ होना है, यहाँ से यहाँ आ गया. This is another example of a wandering spleen when you do the sleeve gastrectomy. So a normal spleen which has a long, loose and vascular splenic pedicle but lacks the ligamental attachments typically is called wandering spleen. Chronic pancreatitis में which branch of portal vein? Splenic vein. Because if you look at tail of pancreas, this is in relation to splenic vein. Any pancreatitis will cause inflammation and lead to splenic vein thrombosis. When splenic vein thrombosis, what will happen? The greater curvature of the stomach develops varices, classically. Radical neck dissection, come on. Oh, beautiful. Most common early complication of tips. మీరున్నారు ఆ రోజు టిప్స్ క్లాస్లో భరత్ చెప్పండి. Hepatic encephalopathy. When you do the shunting, no, any shunting will cause ammonia directly without detoxification entering into blood leading to hepatic encephalopathy, na, doctor. And you asked me a very important question. Are the are the portovenous shunt surgeries are same as tips? Did you get the answer? Same, huh? Okay. What is the cause of nausea, vomiting, and carcinoma head of pancreas? It is the external compression of duodenum, which lead to the nausea and vomiting whenever the duodenal C lobe is being compressed. Treatment of choice for bleeding gastric ulcer is anthrectomy. A suitable graft for aortic aneurysm? Huh? నువ్వేమంటావు? టెఫ్లానా? PDD గ్రాఫ్టా? నప్ప డాక్రాన్. Dermatitis herpetiformis associated with 3, వేసేద్దామా 3? TTG 3. వెరీ గుడ్. ఇది అడుగుతారు రేపు దీక్ష పెట్టే. मैंने बोला ना, पेम्फिगस वल्गैरिस, बुल्लस पेम्फिगॉइड, डर्मेटाइटिस हर्पेटिफॉर्मिस. पढ़ो दीक्षा, पढ़ के मुझे व्हाट्सएप करो. आई विल बी वेरी हैप्पी. आज मैंने पढ़ा सर, हमारा Sandeep Divakar is saying, sir, all these are PYQ. What is PYQ? Previous year questions. Oh, previous year questions, sir. Some of them here and there. Yes, because there's a very little scope for new questions really to come. So I'll give you around 15-20 papers with new questions, some of the new questions. So it's a mixture of both, so that it will be more closer to what examiner is going to ask. Right, doctor? So now, doctor, what is this called as? Wide watermark dermatitis, otherwise called diaper dermatitis. So it's a band-shaped papular dermatitis. Band shape, band లాగా ఉండాలప్ప. పాపులర్ ఈరోజు అల్సర్ కాదు అది. బియా కాంటాక్ట్ డెర్మటైటిస్ used in disposable yes. There is something called irritant diaper dermatitis. That irritant diaper dermatitis. No. There are two things: irritant diaper dermatitis, and other one is the dye associated dermatitis, that is band shaped papillary dermatitis. So this pattern fits into that band shaped, which is not irritant, but it is in the distribution of diaper. That's the point. Okay. Then what is this lesion in the oral mucosa? Yes. So like in Wickham's tree, Potrier's microabscess, ఇది చెప్పకుంటే ఊకోరు. Mycosis fungoides, which is cutaneous T-cell lymphoma. What else do you find in that? Sézary cells. How do you identify them? Their nucleus contain cerebriform nucleus. Cerebriform nucleus, Sézary cells, cutaneous T-cell lymphoma, mycosis fungoides, Potrier's microabscess. All these are, so these are the abscess means actually there is no pus, there is a neutrophilic accumulation. To prevent combustion during anesthesia, what combination? Oxygen 25, helium 75. Now, what is the landmark of superior laryngeal nerve block? Come on, Diksha. Superior laryngeal nerve block. Greater cornu. See, this is hyoid bone, no? The greater cornu of hyoid bone దగ్గర ఇంజెక్షన్ ఇస్తారు superior laryngeal nerve కోసం. ठीक है? So endotracheal intubation, what is accept? So ET inserted under direct vision of glottis, CO2 in expired air, bilateral chest movement should be there. Otherwise, your ET tube has gone all the way into, what is the common mistake done? Toi. You'll be push in tension में आप क्या करते हैं? पूरा ET tube को ले जाके right bronchus में चलाते हैं और left bronchus will go into atelectasis. So both the lungs must be expanding well. So then, doctor, all are true about transtracheal jet ventilation. This is called transtracheal jet ventilation. So it is high rate, high flow, can be given through cricothyrotomy, not endotracheal tube. Cricothyrotomy करके उससे वो jet ventilation देते हैं, ठीक है? Stochastic effect of radiation means what? It's a genetic mutation. So your exposure is now to radiation in childhood. Adulthood may it will lead to papillary carcinoma of the thyroid. So that's called stochastic effect. So that's the reason हम बच्चों को unnecessarily ले जाके radiation exposure नहीं करना. Just because you are a pediatrician mama, for little cough also, let me take and then check, means that unnecessary radiation exposure is not good. Permissible radiation for radiation workers, it is 50 millisieverts per year. Radiopharmaceutical for phagocyte study scan is sulfur colloid scan. Then those who have OCD, if you do MRI to them, why do they have OCD? Their caudate nucleus is reduced in volume. So conduct disorder आज will become what? Personality disorder? Good. Somatic passivity is present in? Very good. Amma, ఇవాళ వినీష బ్యాటింగ్ ఫుల్ బ్యాటింగ్ చేస్తున్నది. Okay, పోలే. So what is meant by somatic passivity? The body is passive, as if done by others, not oneself. It's like without doing question paper, coming to Murli Bharadra's class will make you somatic passive. So it is a Schneider's first rank symptom. Why schizophrenics will go into somatic passivity? वो दूसरे लोग क्या बोलते वो करते जाते. As such, they gave up their body to them. So it is called sense of self is retained, while part of the self is believed to be under the control of outside. Remote control. People go to costly coaching programs, no, 1 lakh rupees. Weekend morning 9 o'clock to evening 8 o'clock, they give their body, mind, soul, everything to teacher. Brr, 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 he's teaching, and his wife is waiting in Delhi. Huh? And you are at one point of time, nothing registers, but you don't feel like leaving because you paid 1 lakh rupees. Understand? बट कम टू मुरली भरद्वाज सर क्लासेस, हम कॉफी पिलाएंगे, चाय पिलाएंगे, अगर आपका मूड अच्छा नहीं है तो हम पॉपिंस पिलाएंगे, कुछ भी करके पढ़ाएंगे. ओनली प्रॉब्लम इज यू हैव टू मॉर्निंग ऑनवर्ड्स कीप रिमाइंडिंग, सर आ रहे क्या, आ रहे, आ रहे ना. अब आप तो शुरू हुआ होगा घर में. गुड, थैंक्स फॉर making me inspired to come to the class. In severe bronchiolitis, for every 10 mmHg increase in PCO2, how much bicarb will increase? 1. నేను చెప్పాను కదా, అయ్యో యాసిడ్ బేస్ డిస్టర్బెన్సెస్లో కాంపెన్సేటరీ ఎసిడోసిస్, కాంపెన్సేటరీ ఆల్కలోసిస్, ఫర్ ఎవ్రీ 1 milli equivalent rise of the CO2, how much of, 10 mmHg, how much carbon dioxide increase అవన్నీ చదువుకున్నాం కదా. అయ్యో మీరు అట్లా మర్చిపోతే ఎట్లా? Then coming back to Sandeep Divakar is asking, sir, where to attempt this paper, sir? Sandeep, please click on this WhatsApp joining link. So we have a score app, score NEETPG app it is called as. All 2 lakh students know about it, Sandeep. You should also know about it. So, yeah. Prune belly syndrome. By the way, one student, Soumya, yesterday gave 5-star excellent app in the Google Play Store. I'm so happy to see that. So I request all of you to go to the store and please give one excellent comment. I will be acknowledging personally. Thanks for the comment. And that makes all difference to us, because when somebody types NEETPG, score NEETPG app to come onto the top, it depends on how many good people thrown the tomatoes, right? So, so please do write a 5-star comment about score NEETPG app. We'll give you a good discount also if you write a comment and send us the screenshot. 5 times, sir. So prune belly syndrome, what does it include? Deficient abdominal muscles, undescended testis, and urinary tract abnormalities. This combination is called triad of prune belly syndrome. Severe acute malnutrition बोलने के लिए what is accept? It is a weight for height, not weight for age, which is criteria. Weight for height or weight for length is the criteria. Because ये तो cheap chitka question. What is this answer? Hey, if you answer this wrong, ఒకటేమో thumb sign, ఇదేంటి steeple sign. Steeple sign ఎక్కడ ఉంటుంది? Laryngo, tracheo, bronchitis. Crew. కావద్దు అట్లా కన్ఫ్యూజ్ ఎట్లయిపో. యూ కాంట్ టెల్ నో, కన్ఫ్యూజ్ అయిపోయి ఐ కిల్ యువర్ లిటిల్ బేబీ ప్రీటరమ్ అంటే ఊరుకోరు కదా. Common confusion is between ABG, BBG. Instead of striking artery, people strike the vein and then send that cherry red color, black venous blood. You should recognize it. But it's okay, you know. It's a blind striking, no. Sir, magical thinking means Vinisha. ఇట్లా పెట్టగానే ఫౌంటైన్ లెక్క వస్తుంది బ్లడ్ ఏబీజీలా. Abba. So now, what is this X-ray heart figure of 8? So, ఏంటి చెప్పండి ఆన్సరు. సో
figure of eight కాదు సార్ అది. It is that is this side figure of eight clearly snowman లా ఉంటుంది సార్.
అప్పా right and left pulmonary veins combine to form the common vein, and on other side your SVC is coming. That makes the upper part. Below is the heart. Total anomalous pulmonary venous circulation. Pulmonary venous circulation, total anomalous pulmonary venous circulation means instead of draining into left atrium, pulmonary veins are drained into right atrium. Also, SVC, IVC are coming. So, left and right will form one common pulmonary vein that combines with SVC and IVC to form ultimately figure of eight. Okay? ఇది ఫిగర్ ఆఫ్ ఎయిట్ ఎట్లనా? దీన్ని ఇంకోటి ఏమంటారు? స్నోమ్యాన్ సైన్. నువ్వు అదన్నా గుర్తుపెట్టుకో, ఇదన్నా గుర్తుపెట్టుకో. ట్రంకస్ ఆర్టెరియోసస్లో ఏముంటుంది? కాటన్ లోఫ్. లేదు, నువ్వు కాటన్ లోఫ్, ఇది కాటన్ లోఫ్ ఎట్లయితుంది? కాదు. It is not seen in cystic fibrosis, no limb anomalies. And what is this, doctor? It is a vital intestinal cyst. Acute rheumatic fever. What is the criteria in the school age children? According to 2015 update, low risk, moderate to high risk population. That's how you divide them. So I leave the literature for you in the app for you to review that. So what is most oxygenated fetal blood, doctor? Even Trilok said it is snowman. And Trilok said it is total anomalous pulmonary venous drainage. Come on, doctor. So, yeah. Then 5-year-old with renal mass. Most common cause in this age group is 5-year-old అంటే విల్మ్స్. విల్మ్స్లో ఏముంటుంది? ట్రైఫేజిక్ హిస్టాలజీ, వేగర్ సిండ్రోమ్, విల్మ్స్ ట్యూమర్, ఎనిరిడియా. జిఆర్ మీన్స్ ఆర్ ఫర్ ఒకసారి చూడండి, జిఆర్ జెనెటో యూరినరీ అండ్ రీనల్ అనామలీస్. చెక్ దట్. వేగర్. Then increased and bilateral involvement. R means genitourinary anomalies. Correct aithe vegar. PG even infusion deteriorate which condition? Will deteriorate condition which are the following? Whenever there is any supracardiac total anomalous pulmonary venous circulation. See, what are the various ways by which total anomalous pulmonary venous circulation can occur? Right and left pulmonary veins combine. They can go and drain into SVC. They can go down and drain into IVC. Or they can directly drain into heart. So, PG even infusion, if you give anomalous total pulmonary venous circulation, results in cyanosis. Why? So typically what is happening, doctor, in anomalous pulmonary venous circulation? The left-sided good blood is going and mixing with the right side. Understand? So with the right side. If you give prostaglandin, what will it lead to? Ductus arteriosus patent connecting the pulmonary artery and aorta. Right? So the good blood came and mixed with bad blood, went into right ventricle, into pulmonary artery, right? Into pulmonary artery. So, uh, what will happen if the conduit is opened? Conduit is opened,
If it is open, then the circulation of the body is there is little circulation. If it is
it
closed,
is restored,
yeah.
right?
EPV now, the only thing the body is getting ready is to patent ductus arteriosus, sir. For PG instruments, both are only.
Hmm.
So there is no blood flow to the body only. That's why the condition deteriorates if it gets closed.
Here the funda is, if the PDA is opened, high pressure is there in aorta or in pulmonary artery?
I pulmonary artery because there is only one flow.
After birth,
After birth also in there.
aorta is higher, no? Aortic pressure is more than pulmonary artery, no? So that will push the blood through PDA into the pulmonary circulation. At the same time, this anomalous circulation is also bringing blood into pulmonary circulation. Both of them in turn will lead to too much of pulmonary congestion. So that is the reason we should not give PGE one infusion. So that's the point. So what is this, doctor? This almost like a boat, scephalocephaly. While treating a child with head injury, giving mannitol, how much osmolarity should be maintained? Less than 320. Why? If blood become hyperosmolar, then hyperosmolar blood will predispose to development of renal failure and acute tubular necrosis. So what is the common mistake done by all residents? Marital, before me, somebody wrote in the morning rounds. I will also write repeat. I will also write repeat, 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 repeat. You are continuously repeating mannitol. Number one, there is a tachyphylaxis. It won't work beyond a certain period of time because it is all osmolarity based, no? And if it lead to too much hyperosmolarity, that predisposes to ATN. So that's the reason you need to be doubly careful about when you are repeating the mannitol. What is the definite indication for lumbar puncture in a child with febrile seizures? Then febrile seizures, once fever, you control seizures, go away. But all infants less than 6 months, children 6 to 12 months with no hip vaccination, severely ill infants with clinical signs and symptoms, they all require lumbar puncture, even though it is a febrile seizure. Then 10-year-old systolic murmur, ultrasound is shown. What is it showing? Ultrasound. It is causing from right ventricle to left ventricle, between the two, it is created a VSD. So VSD is there, systolic murmur is there, cyanosis is there. What is your diagnosis? Huh? Tetralogy of Fallot. But tetralogy of Fallot, systolic murmur is due to? Very good. Not VSD. And tetralogy of Fallot, prognosis decided by? Pulmonary stenosis. Child with bouts of laughter. You watched the movie Joker, no? So, bouts of laughter is Angelman syndrome. Robert De Niro movie, Joker. So, deficiency of E3 ubiquitin protein ligase gene on the chromosome 15 causes Angelman syndrome, is what you need to remember. So, once more, Angelman syndrome, Prader-Willi syndrome. ये दोनों को गर्मा गर्म रिवीजन करना है हमारे स्कोर ऐप में, आपको सर्च करे तो मिल जाएगा. So that is the story. So a newborn presents with purpura fulminans. Other two siblings are normal. So it is a classical skin necrosis. Warfarin induced skin necrosis is common in protein C deficiency. You remember, no? Two things. Bluetooth syndrome. Blue nail. Other day we have seen, no, warfarin shuru kare to there is a dislodgement of, that is one blue toe syndrome. Other is, if you start warfarin without fundiparinox, without heparin, it lead to development of warfarin induced skin necrosis because of the fall of the protein C, protein S first before 2719. Gurtochinda? Most common infection in pandas is, definition of pandas and any mundu. Pediatric autoimmune neuropsychiatric disorders associated with streptococcus pyogenes. That means if a kid gets sore throat, he can become psycho. Pediatric autoimmune neuropsychiatric disorder associated with streptococcus pyogenes. 22q11 Dijot syndrome. In Dijot syndrome, there is a parathyroid aplasia. Because of that, there is a development of hypocalcemia. Tells that Dijot. 1-year-old female, normal at birth, presents with microcephaly, regression of acquired language, motor milestone, along with abnormal stereotypical movements. ఇది తప్పు చెప్పిందంటే నేను అసలు చదువు చెప్పుడు బంద్ చేసిస్తా. You said Rett syndrome? Good girl. That's good. Rett syndrome occur in girls, appa. Rett is Rita. Rita is a girl. Okay? So always remember, a female child, normal at birth, normal early development till the first year, followed by neuroregression and stereotypic hand movements is Rett syndrome. A topper in NEET UG, joined MBBS, first year studied very well, got a distinction, second year fell in love, dumped a couple of boys and got dumped by another couple of boys. She becomes Rett. Right? So remember, earlier अच्छा बात करना, मम्मा डैड बोलना, वॉकिंग करना, सब कुछ आ गया. Then suddenly regression starts with stereotypic hand movement. That is Rett syndrome. Okay? So, doctor, 2-minute voice breaker. We'll finish some pharma and take a break. Emmanuel Zaddik is saying, sir, how can I get the notes? Very simple, Emmanuel. Please join our WhatsApp group. Somebody will reach you out. There's the joining link. Please join WhatsApp group. Through joining link. We reach out to you and help you subscribe and courier you the notes. అదొక్కటేనా ఇంకా వేరే క్వశ్చన్ తప్పునే? అదొక్కటేనా? అది కింద పైన ఉంది ఒక క్వశ్చన్. కరెక్ట్. బట్ దాని ప్రకారం రెట్ వచ్చిందా? అవునా? ఓకే, నో ప్రాబ్లం. We'll correct it. So, doctor, temozolomide. అసలు ఇందులో ఎన్ని కరెక్ట్ పెడతాడో భరత్ సంగతి ఇప్పుడు భరతం పడుతుండు. Temozolomide, what is the mechanism? Alkylation of DNA. ఇగోండి డాక్టర్ గారు, మేము ఇవన్నీ చదివినాం, దుమ్ము చదివినాం ఫార్మకాలజీలా. గిరిజక్కని అడుగుండ్రి, మస్తు చెప్తుంది. అబ్బా ఏం చెప్పినావు సార్ పాఠం. I do enjoy teaching Girija and Sai Krishna Reddy in those days pharmacology. Temozolomide. It is a tyrosine DNA alkylating agent used along with radiotherapy in malignant glioma. एक ऐप के बिना entrance नहीं होगा. So what is the monoclonal antibody used in head and neck cancer? Pembrolizumab. एक होता है Keytruda. దరిద్రుడా అన్నట్టున్నది Keytruda. So there is something called PD L1, doctor. This is PD1. This is ligand. This is the receptor. So here you have T cell receptor and tumor express antigen. So PDL1, PD1 binding, it will inhibit the T cell from killing the tumor cell. It will inhibit the T cell from killing the tumor cell. And blocking this PDL1 or PD1 will allow T cell to kill the tumor. So pembrolizumab क्या होता है? Humanized monoclonal antibody that blocks the interaction between PDL1 and PD1. PD1 किसके ऊपर रहता है? T cell के ऊपर. PDL1 tumor cell के ऊपर. And that is how melanoma, unresectable or metastatic melanoma, they're all being treated. Which drug should not be used with midazolam? Ritonavir, because P450 inducer. Mirabegron is a beta-3 agonistic drug. Beta-3 stimulation in the bladder will relax the detrusor muscle and increase the bladder capacity. Typically used in stress incontinence. When there is an overactive bladder, then you use mirabegron. ये भी हमने हमारे नोट्स में मिल जाएगा. आप सर्च ऑप्शन मार दिए तो स्कोर ऐप में. So I'm very excited. Tonight we should be able to update it into the Google. By tomorrow you'll have whole world available to you. And also we have an open API released by Elon Musk. Elon Musk of Tesla is there, no? They're after acquiring Twitter, they created one very interesting open API, which I'm asking my developers to use. In that API, if you enter any keyword in the question, automatically it will go and make a search in the available research journals and all, and bring the relevant paragraph and create a explanation. Could you get me? So we need not create explanatory answers and provide for every question. Simply there will be a button. If you want, you click on that, it will give you the explanation. I mean, it will do what Google is doing, but you can incorporate it as an open API into the application, right? Ideally, all medical students should learn development. Software, Python, all these are nothing before all the kachra that we study in MBBS. I'm hands-on coding in Java, Spring Boot, and Python Django framework. It's very easy. It's fun. A small kid can do that. So, time-dependent PK shown by which drug except linezolate, lincosamide, meropenem. Asal mundu, what is meant by time-dependent pharmacokinetics? So typically, if you look at the antibiotics, time-dependent and concentration-dependent. Concentration-dependent means how long the concentration of the drug remained in the area under curve is called concentration. Whether the concentration is there under the area under curve or not. This is how long it remained above minimum inhibitory concentration is called time dependent. So time dependent is concentration independent. And the bacterial killing is unaffected by increasing drug concentration. It is all about how long it remained more than MIC. Then the other one is what? Concentration dependent. So how high that particular drug could reach and under AUC is considered to be concentration dependent. Now, Diksha, tell me, are you a time dependent NEET PG aspirant or concentration dependent? Concentration dependent. Vinita also is concentration dependent. That's the reason I'm saying be concentration dependent. Study the last 60 days with Murli Bharadwaj, keeping your area under control, under curve, instead of reading months together, right? So, what are concentration dependent? Now, idanta okay. Sod okay. ఇది అసలు సోది చెప్తామమ్మ సోది. ఏవి కాన్సన్ట్రేషన్ డిపెండెంట్, ఏవి టైం డిపెండెంట్. ఎవడు గుర్తుపెట్టుకుని సావాలకి ఇవన్నీ ఉల్లిపాయలని, ఎల్లిపాయలని, వంకాయలని, బీరకాయలని. బట్ దట్ ఈస్ కాల్డ్ ఎంట్రన్స్. Who will remember all this stupid stuff of vegetables? Tarkariyon ka count. Aminoglycoside, fluoroquinolone, daptomycin, metronidazole, amphotericin, erythromycin, they're all concentration dependent. So iske liye ek trick hai. Either you remember this or this, not both. Then you are not Murli Bharadwaj students, right? So concentration dependent is followed by all except linezolid. So in a child of infantile spasm with visual defect, which drug is not used, even though it is very effective for infantile spasms? V for visual defect, V for vigabatrin. Vigabatrin is very effective on infantile spasm, but it leads to visual field defect. That's the reason we don't use it unless all other drugs, if the things have failed. So this is, doctor, please support vigabatrin. Tofacitinib, one nib will nib you in the exam hall. Sometimes two nibs, like imatinib, mesylate, which you use in, where do you use? Come on, doctor. Imatinib, mesylate. Common conditions లోనే అడుగుతా. దేంట్లో వాడతారు? Chronic myeloid leukemia, CML, Diksha. बोल बोल के मेरा गले में हराश. చదువుతావా దీక్ష? సిఎంఎల్ చదువుతావా? ఏఎల్ఎల్ చదువుతావా? ఏఎంఎల్ చదువుతావా? బాంచను, నీ చేతులు మొక్కుతా బాంచను. చదవాల బాంచను. ఏఎల్ఎల్, ఏఎంఎల్, CML, CLL, HLN, HL, MM, multiple myeloma, and HCL, hairy cell leukemia. ये पेटकोंडी ये पूरा खत्म करके मैं मुरली सर को आत्म शांति के लिए एक फूल समर्पण किया जाए. So it is what tofacitinib is a oral JAK inhibitor. Where do you find JAK stat mutations? Polycythemia rubra vera. Where do you get aquagenic pruritus? नहाए तो कुलजी लगेगा, खुजली. అదే పాలిసైథేమియా రూబ్రా విరాలోనే. ఎందుకు పాలిసైథేమియా రూబ్రా విరాలో ఏమవుతుంది? ఇట్స్ అ మైలోప్రొలిఫరేటివ్ స్టేట్. Both basophils and RBC, both of them are increased. Basophils will degranulate when you take a hot shower and they release the histamine that lead to pruritus, aquagenic pruritus. Then dose reduction is needed in renal and hepatic impairment. So, doctor, tofacitinib, please support our company, doctor. Oral JAK inhibitor is tofacitinib. About volume of distribution, मैं क्या बोला? VD, T half, bioavailability, first pass metabolism, zero order kinetics, first order kinetics, steady state concentration. Abhi bolo, what is your answer? Come on, online students, what is your answer? One firm answer. So it is proportional to T half. Skeletal muscle relaxants have a low VD. High plasma protein drugs have low VD. Obviously, if it is highly plasma protein bound, it won't go into tissues. If it doesn't go into tissue, VD will be low. Then T half is equal to logarithm of 2 by K, 0.693 by K. K is the elimination rate constant. K is equal to clearance by VD. So T half is equal to logarithm of 2 into VD by CL. So that is the reason it has become what? Clearance is in denominator, volume of distribution in numerator, with which T half is related. So VD is equal to T half into so ఈ ఫార్ములా అర్థమైంది కదా. సో VD is directly proportional to T half. If clearance is constant, highly plasma protein bound drugs have a low VD. Thrombopac, thrombopoietin agonist. Actual drug resistance is not because of DNA gyrase inhibition. That is the mechanism of action of fluoroquinolones. Which is a EGFR antagonist ఎవరు చెప్తారా? డెఫినెట్గా ఎట్లాంటివి కాదు, ఇప్పుడే చెప్పుకున్నాము. ఇక చెప్పుర్రి. ఎట్లాంటి నిప్పు కాలే కదా, ఇంకా ఇంతకుముందు చెప్పుకుంది ఏంటి, ఏం నిప్పు అది? ఇది టొఫాసిటీ నిప్పు కాబట్టి ఇది 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 గుర్తుపెట్టుకోండి, ఎర్లాటినిప్. సో యూ హ్యావ్ ది epithelial epidermal growth factor receptor, EGFR receptor. So it undergo autophosphorylation and that decreases apoptosis, that lead to cancer. So if you give erotinib, then this autophosphorylation of the tyrosine kinase linked with the EGFR is being prevented. So that once more apoptosis will happen. That will kill the cancer. Clear? Am I clear? So मैंने एक लिस्ट दिया बेटा, पूरा निब्बल एब्ल, निब्बों याबों में हमारा जिंदगी डिपेंड होता है. जरा जाके वो 1200 pages notes is the gold standard. Please don't miss it. It is used in metastatic non-small cell lung cancer. Then what are the tyrosine kinase inhibitors against vascular endothelial growth factor? Sorafenib, sunitinib and pazopanib. जरा उर्दू भी सीख लो एंट्रेंस के लिए. अलीफ, बे, पे, थे. So Arabic and Urdu also भी जरा पढ़ लो. So VEGFR, sorafenib, sunitinib, pazopanib. Now about volume of distribution, this is too much. Who will remember all this stuff? Heparin less than, gentamicin less than, phenytoin less than haloperidol. So what are the factors that affect volume of distribution? Molecular weight, lipid solubility, plasma protein binding and tissue binding. Always remember, acidic drugs have low VD. Similarly, in edematous condition, water-soluble drugs will have high VD. High VD is equal to high tissue binding. So digoxin, chloroquine, the VD is decided by their tissue binding ability. CML with T3151 mutation. What do you use? We use ponatinib. Ponatinib is the third generation. Imatinib ఉంది కదా, imatinib का बड़ा भाई ponatinib. ఏమో వినిషాకి ఏమో ఈ నిబ్బులేంది, ఈ యాబులేంది, కథలేంది, గుర్తుపెట్టుకున్నాడేంది. కాపీ కొడితే అయిపోతుంది, వదిలేస్తే అయిపోతుంది. నో, ఇది మంచి స్కోరింగ్. वो नोट्स में मैं एक 2 पैराग्राफ दिया हूं, बट्टी मारो. Which we all got used to fighting with boyfriend by saying, you bloody sucker, you have spoiled my life. Abhi kya karo? You what is that? You ponatinib. Shut your imatinib. तेरा गाली देने के लिए कोशिश करो. The boyfriend also will get revision. You will also get revision. That is better now. So then tubular lumen for diuretic action, which don't go to the tubular side. Tubular lumen look elli ganaka act kavalankondi. If it need to go to tubular side and act, then it need to be filtered, GFR. If it doesn't need, then even if GFR is low, you can use it. If you look at spironolactone need to go into, but eplerenone don't need. That's the point. Adi vettam answer. So Trilok said, sir, could you clarify regarding 115th question, B option? Okay. 115 B option. Chudandi. Trilok ke Anirudh say. Trilok said, sir, how will you explain B? Okay. T half is logarithm of 2 divided by K. Doctor, K is the elimination constant. Right? So let me come. T half is equal to logarithm of 2 divided by K. And how is K given? K is equal to clearance by volume of distribution. So K ke jagah pe clearance by volume of distribution lagao. Then T half is equal to logarithm of 2 divided by clearance by volume of distribution. Right? So that is equivalent to, it will become reversed when it goes up. So T half is equal to logarithm of 2 into Vd by clearance. So Vd is equal to, this will go up, T half into clearance T divided by logarithm of 2. Clear? Okay. Trilok, could you get the point? Simple arithmetic.
Yeah, sir, but options are multiplied by log 2.
Oh no, volume of distribution T half multiplied by log 2.
Divided by.
T half.
Actually, not
1 minute. Volume of distribution is calculated by T half multiplied by log 2. It is not like that, no? Vd is equal to T half into clearance by log 2, no?
EF is equal to log, EF is equal to 0.6 by K.
మంచిగా ఇద్దాం మళ్ళీ ఇక్కడ ఈక్వేషన్ ఇద్దాం ఫ్రెష్గా. We'll put a fresh equation for clarity of everybody. First, T half is equal to
0.6 by.
No, first. Let's be very clear. T half is equal to logarithm of 2 divided by K. K is elimination constant. Then K is equal to clearance by volume of distribution. Clearance by volume of distribution. Then so everything else we play. So T half, I'm also becoming what is that? क्या नाम है उसका? Physics वाला. अच्छा देख लो T half क्या होता है? Logarithm of 2. Logarithm of 2 बच्चों. K क्या हो गया बच्चों? Clearance by VD. यहाँ लाओ. ये क्या हो गया? Clearance by VD हो गया. If it is 1 by 2 by 3, वो क्या हो गया? इधर उल्टा हो गया. ये become 1 into 3 by 2 हो गया. वैसा भी ये भी क्या हो गया? Logarithm of 2 into VD by CL हो गया. क्या हो गया? T half. अभी अगर VD को यही रखो और इसको इधर लेके जाओ, ये क्लियरेंस इधर आ गया और लॉगरिथम ऑफ 2 नीचे आ गया, तो वीडी क्या हो गया, टी हाफ के नीचे लॉगरिथम ऑफ 2 हो गया। मगर क्वेश्चन में क्या दिया, टी हाफ मल्टीप्लाइड बाय लॉगरिथम ऑफ 2 दिया, रॉन्ग है ना? अरे वाह, क्या बात है। सो I used to love physics wala, real physics classes. Really, the guy used to do beautiful. मजे में पढ़ाते। तो त्रिलोक समझ में आ गया? Good. This is called Trilog block. So which drug? Oh, even PowerPoint is also over. Next PowerPoint. So Vinisha, slow number, fast number ఇవాళ. ఇంకా ఫాస్ట్ కావాలన్నా స్లో కావాలన్నా? ఓకేనా? ఇంతకంటే ఫాస్ట్ అయితే మల్టిప్లికేషన్ డివిజన్లు అర్థమవుతలేవు. ఇవన్నీ మీవా? కంగ్రాచులేషన్స్. హాయ్.
All these questions are not from one people. It's from one people only. From Jitmal. 2020. Yeah, those questions.
Let's take a quick 2-minute voice break. రేపటి నుంచి మేము మా నర్సెస్ అందరికీ కూడా క్లాస్కి వస్తే 999 రూపీస్ ఈజ్ ద ఫీజు. ఒరిజినల్ 15,000 కాస్తే 999 చేసి పడేసినాం. తర్వాత ఇంట్లో నుంచి వింటే 2,000. ఎవడైనా ఫేస్ టు ఫేస్ క్లాస్ చీపర్ చేయడు ఆన్లైన్ కంటే, మేము అట్లా చేస్తాం. ఇక్కడ మాకు స్టూడెంట్లు కావాలి క్లాస్లో. So a lot of people, nurses are all excited about this. Then I checked who are our competitors in the staff nurse recruitment exam coaching. I will easily kill all of them. Right? So MD only I kill a lot of competition, but there I will atrociously kill all of those poor nursing tutors who started coaching programs. Right? So, all right, 2 minutes. Let me take a So, welcome back, doctor. For this primary effusion lymphoma, it is also called body cavity lymphoma. So, you need to know what are the CD markers. Emperipolysis means what? Emperipolysis is typically seen in autoimmune hepatitis. It is active penetration of one cell by another cell, which usually remains intact. So it is the engulfment of hematopoietic stem cells, cells. Generally, the cell which eats is megakaryocyte, which enters is erythroblast, myelocyte or neutrophil. एक cell दूसरे cell को खाएगा. Co-stimulatory factor for T cell are B71, B72 and CD40. If you know this, you know this, otherwise gone. These are all seen in Fragile X syndrome. Trinucleotide repeat, mental retardation, testicular enlargement, which is a germ cell tumor, germinoma, teratoma, embryonal cell carcinoma. Antischkoff cells are seen in rheumatic fever, even iron deficiency, and recurrent aphthous stomatitis. About myelodysplasia, typically 5q deletion has got a good prognosis, not a bad prognosis, very good prognosis. Most common site for gastrointestinal stromal tumor is stomach. A wedge-shaped area in adrenal gland is affected. But the cellular outlines are intact means? Very good. MYH7 gene focus 14. It provides instruction for making protein known as myosin heavy chain. Myosin heavy chain 7. Which coagulation factor is increased in hepatic necrosis, not decreased? Generally, liver dysfunction means coagulation factors fall down. But which factor is increased? Couldn't have guessed. Famous disorder, which is X-linked. Factor 8. Factor 8. I too don't know this. Pehle baar maybe while preparing for exam, I rechecked once more. Is it true? Okay, it's true. Thrombophilia through protein C. So, factor V leader mutation, estrogens, OCPs, then lupus anticoagulants, they're all thrombophilias. Function of guardian of genome P53 is? No. Reduce cell mutation rate. P53 prevents mutation rate. Life-Romney syndrome is because of the P53 deficiency. So parotid gland, it is mucoepidermoid carcinoma, most common malignant tumor. Right? Actually, pleomorphic adenoma unta the other answer.
Melanoma is benign only, sir.
Benign. Histology of type 2 autoimmune pancreatitis is మళ్ళీ దీంట్లో type 1 2 కూడా ఉంటుందా? అదే ఆన్సర్ చూపిస్తే మీరు చెప్తారు పక్కన. సరే, ఇది ఆన్సర్ చూడకుండా చెప్పండి. మోస్ట్ ఇంపార్టెంట్ ఫ్యాక్టర్ డిటర్మైన్ హైలీ సెలెక్టివ్ ప్రోటీన్యూరియా. న్యాచురల్గా చెప్పండి. హైలీ సెలెక్టివ్ ప్రోటీన్యూరియా. Defective charge. Abnormal urinary excretion of proteins is a feature of glomerular diseases. The first is increased charge and size permeability of glomerular capillary membrane. In chronic smoker, bronchi shows stratified squamous cells. Metaplasia. With underlying glands. See, metaplasia is reversible. Reversible change, okay, replaced by another. అంతవరకు కరెక్టే.
నాకు చెప్పడం ఏమో చెప్పాడంటే డే బిఫోర్ ఎస్టర్డే ఐ ఆస్క్డ్
Oh,
స్ప్లిట్ ఎట్లా డివైడ్ చేయాలి అంటే ల్యాండ్ అని కనిపిస్తే డైరెక్ట్లీ
deranged cellular structure like pleomorphism and all that is dysplasia. One mature cell type into another mature cell type is metaplasia. Okay, agreed. So the myocardium following myocardial infarction is being shown. Actually, in the exam it was not shown. So what is this? Rupture. So when does rupture occur? 2 days after rupture will occur. Free wall rupture. About Wilms tumor, it doesn't present at birth. It presents at between 2 to 5 years of age. And what is Denish-Dash syndrome, Wiedemann syndrome, and Wager syndrome in relation to Wilms? Wager is Wilms tumor, NDDR, genital anomalies, mental retardation. Mutation of WT1 and PAX-R gene. Denish-Dash is male pseudohermaphroditism with diffuse mesangial sclerosis and gonadoblastoma. Associated with WT1 gene. Beckwith-Wiedemann is organomegaly, hemihypertrophy, omphalocele, adrenal cytomegaly, macroglossia, associated by WT2. ఇవి తప్పవు. ఇవి కామన్గా అడుగుతారు దీక్ష, వద్దన్నా కూడా గుర్తుపెట్టుకో. జిందగీలో విల్మ్స్ ట్యూమర్ నేను ఇంతవరకు చూడలే, honestly. I was teaching for past 24 years, but I never got, because I'm not a pediatrician. I am a MD general medicine, but I could. But it's common. Neuroblastoma I seen, but not Wilms. But Wilms చెప్తూనే ఉన్నాం, ఇదే పాఠం చెప్తూనే ఉన్నాం all throughout our life. Cytokeratin 8 and 18 and ubiquitin are present in primary biliary cirrhosis, NASH, and even alcoholic. What is NASH? Non-alcoholic steatohepatitis. दारू पीने का बिना भी अगर फैटी लिवर हो गया तो इसको बोलते हैं नॉन अल्कोहलिक स्टीएटोहेपेटाइटिस. मल्टीपल myeloma, ये తెలిస్తే తెలుసు, లేకుంటే కేల్కతం దుకాన్ బంద్. No more playing casino. Cards are not there. So 14-16 1q gain, 4-14, they're all poor prognostic. Which interleukin lead to Ditra syndrome? पहला Ditra syndrome क्या है बताओ? It is an autosomal recessive disorder because of interleukin 36 genetic deletion. Interleukin 36 has a pro-inflammatory effects on keratinocytes. Loss of this interleukin 36 receptor antagonist will potentiate this interleukin 36 mediated inflammation on keratinocytes, and keratinocytes suffer mutation. That is Ditra. Rat poisoning, black and necrotic skin is due to commonly rat poisons. No. I'll come back. I think there is some gadbad in that question. Identify this lesion. Laceration. The other day, what did I ask? Incision like laceration on the forehead. మళ్ళీ లాసరేషన్ పెట్టినావా? ఓకే ఓకే, అది కొంచెం చూసుకోవాలి కింద పైన. అట్లా ఓహో. No. Why it happened in app is while uploading, they upload it like an Excel. Anything that is there in column B is treated as B. So this being in goes into column B, it is being there. Sorry for that. Consumer Act calls for 2 years. It is called limitation period. 10 years back you gave some drug and that gave drug reaction, means he can't come and sue you. Right? A child presents with hard neck lymph nodes, strong suspicion of lymphoma. Resident orders for biopsy without revealing the reason for biopsy. What is that called? Non-maleficence or beneficence. But if the resident informed and the patient denied, agreed, uh, but still he did biopsy,
Since autonomous.
that's the point. My lord, you should understand the terminologies very clearly. He is using it for the benefit of the patient and he has no malified intention. That's the point. Autonomy means respect for decision making capacity of an autonomous person. Always don't push angioplasty should be done. No, I don't want to be done. I love some very elderly patients used to say, क्या जिंदगी जीते हैं डॉक्टर साहब काय को मुझे आप तो right now you saved me later if I have to perish I'll perish I don't have any wish to live even then you pull him and then put him on coronary angiogram and plasty means he will go and sue you. Huh? So be very careful to give respect to the decision power on their own health. For sterilization control, Bacillus stereothermophilus. Program for screening developmental delay, deficiency, neonatal genetic defects is Australia Bala Swasthya Karyakram program. Right? So all this Janani Suraksha Yojana, all Yojanas, नहीं तो मोदी जी नाराज हो जाएगा. Ayushman Bharat is the most recent one to provide healthcare facility to over 10 crore families covering urban and rural people. The scheme has been renamed as, obviously, until Prime Minister is there, उनका ही होना है ना, प्रधानमंत्री आरोग्य योजना, किसी और का नहीं. वहां भी ओबामा केयर बोलता है वो, कहा यूएस में. So shortly we are launching this app called Iris. Iris में concept is 2 minutes I'll take with your permission, Chairman. So every patient love to meet a doctor. कुछ lab reports आ गया, ECG आ गया तो they feel like Supreme Court summons. Their own doctor don't get time. Other side, patients, medical students are suffering from lack of patience. They love to meet patients, they love to look at their ECG, they love to look at report and give their 2 cents of comment, right? So we are bridging the gap between the two with this Iris app. So there is a doctor interface, there is a patient interface. Patient, as he comes, there is a WhatsApp like screen. It will say, do you want to talk to doctor? Yes. Immediately it will create one order on the doctor's side. Any doctor in this community can just accept that and they both get connected. And also one doctor and other doctors on this side can publish cases, one can get opinion of the other and all that as an engagement of doctors to stay on platform. Now, as a doctor, if you are able to convince patient to become your long-term client, it is up to your ability. So initially we thought of hiring doctors, fixing some fee like 60 rupees and then we take another 20 rupees like that. But that's all bakwas we felt. It's very difficult to scale that. Here, पेशेंट चाहिए तो हम दे देंगे और डॉक्टर चाहिए तो हम आपको मिल जाएगा depending on whoever is ready to come, but we will verify the doctors and medical students that they are genuine people and then only we'll give an activation of doctor account. So now thousands and thousands of cases are going to ask, doctor, see my reports, doctor, see my ECG, doctor, see myself, doctor, see my skin lesion. They keep posting and then you are getting access to that data, right? So, and completely doctor number, patient number, anonymous. Unless in the chat they say, okay, let's meet and meet, fine, that's all right. So I am presenting it to the government that we are going to revolutionize. And these doctors also have uh, point of care decision making algorithms and all that to support them, to give advice, because we know that doctors know not sure about when to give metformin, when to give sulfonylurea and all that. And suppose if they are stuck up with any doubt, they can post it. These patient values are like this. I want to advise him about starting glibenclamide. What is your opinion? Another senior doctor will start posting. So that is the whole purpose of this called Iris Health. The moment I launch, I want all of you to register and then start grabbing the patients and then build your clinical practice. So, did you like idea, Diksha? Good one? Good. So I want Diksha, and we will be giving Diksha helped 10,000 people get a free advice. She's a super free doctor. We'll give some awards. Huh? Doctor is supposed to be free, right? Why it should be costly? And lot of hospitals, private hospital, private medical college, hospitals I see now, very poor patient clientele. You have to pay the patient to touch him. Utta bakwa situation chal raha hai. On the other side, Usmania Gandhi, when you walk in, you have hundreds sitting there waiting for your arrival. So PHC was created with the goal of creating community-based healthcare system. What did Indian government do? Comprehensive health services. So it is a Boer committee, comprehensive healthcare, way back in 1946 before independence. What are principles of primary healthcare? Equitable distribution, intersectoral coordination, appropriate technology like our IRIS platform, and community participation. According to Indian Newborn Action Plan, INAP, neonatal mortality target for 2035 is 9. Straight repeat hota hai MCQ कल के NEETPG में. Don't accuse me that it is 110% strike rate. Single disease control strategy done by vertical program. So the types of national health programs are called verticals, horizontal. Vertical programs, these are often disease specific, hospital based, medically driven. Horizontal are community owned, community directed programs. That's how it differs. First quartile is 34. How much percentage observation will be more than this? Huh? 66 ఉండాలి కదా అంటారా?
No, quarterly is 25.
Huh?
Percentage is 75, sir.
First quartile is 25% of observation. Third quartile is 75%. Right? So, observations between 51 and 75 allocated in third quartile. So that's how it became 75. Agreed? Good question. समझ में आया ना? Kashima operation done in is also known as transverse cordotomy. It is done for vocal cord paralysis, carcinoma, larynx, and bilateral abductor palsy. WHO recommendation cutoff for noise in industrial cities 70 decibels. Cistern case for pyroglossal cyst, even a little boy knows that. Most radio-resistant layer of the retina is ganglion cell layer. Blood-brain barrier is formed by blood-retinal barrier, Muller cells. Muller's glial cells and astrocytes participate in this barrier. Huh? Which one? 156 అప్పుడే అడగాలి. సిస్టర్కి పేరప్ప థైరోగ్లాసల్ సిస్ట్ రిమూవ్ చేసే ఆపరేషన్. See, cistern is along with the body of the hyoid bone. Who said that it is done for fistula also? ఒకసారి చెక్ చేద్దాం. Mizo Nakamura phenomenon in fundus is seen in. पहली बार जापानीज पढ़ रहे हो आप. Mizo Nakamura phenomenon. It's called congenital stationary night blindness. It is a group of disorders where early onset of night blindness in the infancy itself, but the retinal dysfunction is progressive.
It's not progressive.
Huh?
It's not.
Is not progressive. And the fundus has a unusual golden yellow color in the light adapted states, which become normal after prolonged dark adaptation. This is called Mizo Nakamura phenomenon. After going home, you ask your pathologist, do you know, darling, how did you get in MD pathology? Copy mara kya? Mizo Nakamura phenomenon. If you tell correct answer, I'll give you credit. Universal limbal stem cell marker is P63. Epibliferon. It is seen in hypertelorism. Trauma to epicanthus can cause it. Is wrong. Congenital epicanthus it is. Fold of skin and conjunctiva is turned inwards. अभी आ गया OBG. Oh, only 2 hours, sir. We are fast. ఇది తెలియకుండా సెకండ్ 100 అనుకోకుండా ఫాస్ట్గా అయితే ఫస్ట్ 100 కొంచెము ఇట్స్ లైక్ ఏ ఫినామినన్ ఆఫ్ కోఆపరేటివిటీ ఆఫ్ ఆక్సిజన్ బైండింగ్ టు హిమోగ్లోబిన్. ఫస్ట్ ఆక్సిజన్ స్లోగా అవుతుంది, ఫోర్త్ ఆక్సిజన్ ఫాస్ట్గా అవుతుంది, ఎందుకంటే సాల్ట్ బ్రిడ్జెస్ బ్రేక్ అవుతాయి కదా. ఇక ఫటాఫట్ చెప్పు వినీషా, యువర్ డొమైన్. 28-year-old G2P1L1 with last child 1 year back, immediate contraception following vaginal delivery. Sterilization.
And it's not compulsory, sterilization. And she did not ask for complete.
देखो G2
Vaginal delivery తర్వాత sterilization చేస్తాం సార్.
huh?
Immediate sterilization after vaginal delivery.
Vaginal delivery అప్పుడు sterilization చేయడానికి కుదరదు కదా సార్. LSCS అప్పుడే కుదురుతుంది కదా.
ఎవరున్నారు? ఎవరున్నారు?
And she's not asking for a complete sterilization.
Previously, one child of 1 year is enough as a criteria for permanent sterilization. Child norm for sterilization in India is one child of at least 1 year of age. Consent of the husband not needed. Is after all a sperm donor. So based on that. Huh? So, yeah. Hey, really also, what is the role of husband except one drop of semen and a sperm? All credit goes to the woman for bringing up the child right from womb to tomb. So which is not used in emergency contraception? All of them are used. Sperm interaction with cervical mucosa, how do you know? Post-coital test called Hunner's test. It is a test in evaluation of infertility. The test examines how sperm and mucus of cervix are interacting. See, earlier days, today engagement means tomorrow marriage. Nowadays, understand each other for 6 months. 6 months they finish everything and decide that this is not worth. So you have to put in shadi.com. I love to marry a girl who previously did not have Hunner's test. So I want to freshly be Hunner in her life, right? So ఏది తెలియదమ్మా నాకు అదేంటో. పెప్పినికలావు తెలుసు, రుబిన్స్ తెలుసు, ఫ్రైడ్మన్ కర్వ్ ఉన్నది, అదే ఫ్రైడ్మన్ ని అక్కడ పెట్టిండు ఆప్షన్స్ లా. ఫ్రైడ్మన్స్ కర్వ్ ఉంటుంది కదా. 23-year-old 33 weeks jaundice for 2 days, platelet count low, ఇంకా no pa, blood sugar is 40, AST ALT are elevated, serum bilirubin 5, hemoglobin 8.
TLC acute because leukocyte count is more.
Jaundice for 2 days. It is characterized by maternal liver dysfunction, microvesicular fatty infiltration. This is the most common cause of acute liver failure during pregnancy. AFLP is a disease of third trimester, typically between 30 to 38th week, multiple gestation, prior history of AFLP, and male sex of the fetus. Abbai పుడితే అమ్మ చచ్చిపోతుంది. Right? So AST and ALT are elevated. హెచ్ఎల్ఎల్పిలో అవన్నీ ఉండవు కదా, ఉంటాయా? బిల్రుబిన్ పెరుగుతుంది. మరి ఎందుకు అనుకున్నారు ఇందులో? హైపోగ్లైసీమియా ఉంది కదా, అది నాట్ ఏ పార్ట్ ఆఫ్ హెచ్ఎల్ఎల్పి ప్రోగ్రామ్, రైట్? అదొక క్లూ. దెన్ బిల్రుబిన్ ఎలివేట్ అవుతుంది కానీ ఇట్ ఈస్ నాట్ మోర్ దెన్ 5. There is hemolysis even in the case of the acute fatty liver of pregnancy. Then okay, హైపోగ్లైసీమియా ఒకటి దెబ్బతీసింది, అది హెచ్ఎల్ఎల్పి కాకుండా అటు తీసుకుపోయింది. ఆన్సర్ 20-year-old female, primary, 14 weeks gestation with 2 episodes of seizure. 2 episodes of seizure. So epilepsy is the most common problem in the case of pregnancy. Carbamazepine is the one which is being administered. 38-year-old diagnosed with HPV DNA positive on cervical screening. So what do you want to do? Next line of management is colposcopy. Corpus luteum is maintained by corpus luteum is maintained by. It maintains your endometrial lining, progesterone. Implantation prepare chestadi. But corpus luteum is maintained by hormones produced by the corpus luteum and progesterone, estrogen, inhibin, relaxin. Least risk factor for ectopic pregnancy is IUCD causes, not OCPs. C1 examination showed 25 million, 1.5 ml, 15% motility, 15% morphology normal. What is the diagnosis? Esthinona, Ezuna? Asthenospermia, decreased sperm motility. Recommended motility is 32%, progressive motility. So how is Vinisha's preparation for NEETPG? Esthino preparation. Only 15% progress is all not even happening every week. Jara padna bede, garmagaram padna. 18-year-old primary amenorrhea, unicoid features, uterus and gonads are present. What is the done for definitive diagnosis? Chepandi. Serum FSH. So whenever you are evaluating primary amenorrhea, you need to know how is the ovarian function. For that you need to do FSH levels first. Once more, there is one algorithm we discussed in gynops, which you need to revise, doctor. BART test is HCG, AFP and estriol. Placenta with cord attached to margin is Battledore. 37-year-old solid tumor, elevated LDH and HCG means dysgerminoma. 23-year-old with 42 days of amenorrhea and vaginal spotting. You need to do transvaginal ultrasound. Right?
మొన్న కూడా వచ్చినప్పుడు అలాగే అడిగాను సార్ నేను విత్ వై ట్రాన్స్వెజనల్ అల్ట్రాసౌండ్ అని అదే గుర్తుంది.
బీటా హెచ్సిజీ పెట్టినాం.
అప్పుడు మేము బీటా హెచ్సిజీ పెట్టాము. ఓకే అండ్ నార్మల్ అల్ట్రాసౌండ్.
Basically, beta HCG is to confirm doubling time and know whether it is ectopic pregnancy. G2P1 RH negative mother history of hydrops. Now ICT is positive at 20 weeks. What is the next line of management? Doppler of middle cerebral artery. Then primary gravida, recurrent urination, suprapubic flattening of the on palpation, fetal heart sound heard on the extreme left lateral position. Then what is the presentation?
Sir, occipital posterior, sir.
Correct. Very good. OP. Chances of conception maximum at
14th day.
Prior to next
After last delivery.
ఏది ప్రీ ఓవ్యులేటరీనా పోస్ట్ ఓవ్యులేటరీనా ఏది కాన్స్టెంట్?
Post is
post is constant. Post ovulated. మీరే చెప్పారు సార్, నోటిఫికేషన్ టు ఎగ్జామ్ ఇస్ కాన్స్టెంట్.
బాగా గుర్తుపెట్టుకున్నాడు. రైట్. 14 days.
next day. ఇది సెకండ్ టెస్ట్ లో వచ్చింది సార్, అప్పుడు మీకు చెప్పారు.
Uterine
స్టార్టింగ్ సెకండ్ టెస్ట్ లోనే చెప్పారు.
So post ovulatory is constant. Okay. Uterine myxoma does not derive blood supply from vesicle. It does not. Uterine artery, ovarian artery of the round ligament it derives. Isotretinoin to be stopped 3 months before. Labor is said to be prolonged when the duration of first and second stage extends beyond 18 hours. అరే అక్కడ వినీషా ఇస్తున్నది కత్తి అబ్బెట్టినావా భరత్?
ఫస్ట్ స్టేజ్ కదా, ఫస్ట్ స్టేజ్ 12 hours కదా. ప్రైమరీ ఇట్ ఇస్
సరే అడ్డిలో తగిలింది బానే. సో ఒక టేబుల్ ఉన్నది కదా భరత్, ఈ క్వశ్చన్లలో కన్ఫ్యూజన్ ఉండదు. ఇట్లాంటి క్వశ్చన్లో తప్పులు ఉన్నాయంటే మా ఆంధ్ర మెడికల్ కాలేజ్ ఇక జరగవు భరత్, ఇక నువ్వు జరగమ్మా జరుగు, మళ్ళీ నెక్స్ట్ ఇయర్ రాపో. సో యూ విల్ లూజ్ యువర్ ఆర్థోపెడిక్ సీట్. Chordocentesis is done at 18 to 20 weeks. Child with TOF with polydactyly is diagnosed to have vaginal atresia. Then what is the diagnosis? McKusick Kaufman syndrome. Postaxial polydactyly congenital heart disease and hydrometrocolpos in the females. Okay. What was the question number? All right. Then Twin Peaks sign is seen in dichorionic diamniotic. Mesoprostol. Come on, Vinisha. Mesoprostol. ఎఫ్ పెట్టినావా నువ్వు దీక్ష? పీజీ ఎఫ్ పెట్టినావా? ఇది లే కదా, ఎఫ్ ఉందా? ఎఫ్ ఉందిగా, ఈ పన్నే కదా. స్పిల్బర్గ్ క్రైటీరియా, అరే జురాసిక్ పార్క్ స్టీవెన్ స్పిల్బర్గ్ తెలుసు కదా. అయ్యో కనీసం అది కూడా తెలియదా? అయ్యో రామా. See, whenever ectopic pregnancy is there, how do you say, what is the criteria to say it is ovarian pregnancy? Ovary no uterus ki madhyalo oka ఇది ఉంటాయి కదా, లిగమెంట్ ఉంటాయి కదా. సో జస్టేషనల్ శాక్ను ఇది ఆర్ కనెక్టెడ్ బై దట్. అట్లా కొన్ని క్రైటీరియా పెట్టాడు ఎవరు, స్పిల్గర్ మహాశయుడు. దెన్ స్టుడిఫర్డ్ క్రైటీరియా ఇస్ ఫర్ అబ్డామినల్ ఎక్టోపిక్ ప్రెగ్నెన్సీ. రుబిన్స్ క్రైటీరియా ఫర్ సర్వైకల్ ఎక్టోపిక్ ప్రెగ్నెన్సీ. పెద్దోడు వాని పేరు ఒకటి ఆడ వేసేసిండు, బుచ్చిరెడ్డిపాలెం, ఎల్లారెడ్డిపాలెం, మల్లారెడ్డిపాలెం. సో వన్ నేమ్ ఈస్ గివెన్ ఫర్ ఎవ్రీ ఫెలో హూ వాస్ బార్న్ ఇన్ 1800s. రైట్. దెన్ అట్లా. So clue cells are seen in Gardnerella vaginalis. Snowstorm appearance,
Molar pregnancy.
molar pregnancy. Jurette view is the fraction of custom. Custom.
Pockets.
AC type level. ఇట్లాంటి ట్రై కూడా చేయకండి పరీక్షలో. ఇన్ ఎగ్జామ్ హాల్ దే లుక్ లైక్ maybe -1 mark. Gallows traction is applied for female. See, a lot of times, no, when Dhoni is playing, no, we feel, but kotra, we will be shouting. But Dhoni is first saving his wickets and balls, right? So, ఈ బాల్ బతికితే వీని ఓవర్ అయిపోతుంది. దిస్ ఫెలోస్ ఓవర్ విల్ బి దేర్ హూ ఈస్ పేసింగ్ ఎట్ సచ్ ఎ హై స్పీడ్. నెక్స్ట్ guy will come, then he will put sixers. In NEETPG also, you need to know, play like Dhoni to win the World Cup. So this is a doable question, which you know. Then why to unnecessarily lose one negative mark on Jurette view? Nexus criteria. Don't even try. Traumatic cervical spine injury. Not seen in osteogenesis imperfecta. ఇది మళ్ళా సిక్సర్ కొట్టాలి. థిక్ కార్టెక్స్ ఉండదు. Ewing sarcoma peak incidence? Second decade. What is this deformity? Mallet finger. Sunburst appearance of the skull. ఇది ఉంటే పర్వాలే. బోన్ అయితే ఆస్ట్రోజెనిక్ సార్కోమా, స్కల్ అయితే metastasis of the neuroblastoma will be sunburst in skull. ఇది మళ్ళా క్లీన్ బోల్డ్. ఇది తొందర గూగులీ. ఆస్ట్రోజెనిక్ సార్కోమా, you hit means gone. 53-year-old female with acute painful hot knee joint. What is the best investigation? Always joint aspiration for cytology and culture sensitivity. Whenever, because a chronically arthritic joint is predisposed to infection. Even rheumatoid arthritis is a predisposing factor. 78-year-old, diabetes, hypertension, had a fall, unable to walk, X-ray show fracture of neck of femur. Then what is the most associated nerve injury in fracture neck of femur? Sciatic nerve. అబ్బా, ఇట్లాంటి తప్పులు పెట్టడం అంటే కష్టమవుతుంది ఫినిష్. Sciatic nerve. It can occur, not very common. 37-year, what is the most common in the case of humerus? Axillary. Axillary supplies? Deltoid. Biceps spine? Musculocutaneous nerve. And what is the main supinator when the elbow is in flexion? Biceps brachial. Brachialis అంటే మళ్ళా అది వేరే మజిల్. When elbow is extended, నేను చెప్పి చివరికి March 4th కల్లా I'll go into coma. Life is becoming bore. Same question, same story, same thing, same mistakes. Different. Tomorrow Mithuna will come. So Mithuna will not know where is radial nerve, where is. Ayyo. 37-year-old female has a fall on the outstretched hand. Presented with dinner fork deformity. Tenderness over the right arm. Median nerve. కొలీస్ ఫ్రాక్చర్లో మీడియన్ నర్వ్ కాకుంటే సియాటిక్ నర్వ్ కాదు కదా. పోలే నేను అదొక ఆప్షన్ పెట్టామనుకోండి, నెక్స్ట్ ఇప్పుడు కొత్త స్టూడెంట్ విల్ జాయిన్, షియాటిక్ నర్వ్ సార్, షియాటిక్ నర్వ్. Then I'll say, meet Vinisha, please. So we don't accept admissions from tomorrow. Because for cleaning the students who joined 2-3 months back only, there is poor prognosis. What is the use of joining today? So we only take mild cases of MI, not who are with pulseless VT. We don't accept cases. We will only accept premature ventricular complexes. We are treatable. Yeah, Mari sciatic ఎక్కడ ఉంది అంటే join our nursing classes in the morning. Sorry, yeah, sometimes we have to laugh on ourselves when life is going slow. So, pregnant women with long-term history of osteoarthritis, restricted joint movement, severe pain. Always paracetamol is safest drug. Beta Diksha, paracetamol is same as crocin, same as acetaminophen, and it is not same as aspirin. Aspirin is different. Huh? Telska? Pole. 6-year-old fellow and paracetamol. Sorry, ఇది చెప్పు చూద్దాం. What is the thing which paracetamol it is not? Only Diksha. Antipyretic, analgesic, anti-inflammatory. Huh?
Always.
It is not. It is not. It has nothing to do with inflammation. It is only analgesic.
Actually, చాలా కన్ఫ్యూజ్ చేస్తారు నేను కూడా ఎన్ఎస్ఐ అనుకుంటే
యాంటీ ఇన్ఫ్లమేటరీ కాదు. యాంటీ ఇన్ఫ్లమేటరీ అంటే మళ్ళీ నువ్వు ఆస్పిరిన్, డైక్లోఫినాక్ అవన్నీ ఇవ్వాలి. పోన్లే, ఇప్పుడు తెలిసింది కదా. అంటే ఉంటుంది. If you take 100 kilos acetaminophen, it may have light anti-inflammatory somewhere. But that is not the purpose for which it is given. Now, 6-year-old, of course, inflammation में क्या signs है? Dolor, rubor, pallor. Dolor, it kills pain. Rubor, it is antipyretic. So, while he feels tender at the elbow, but otherwise well. Green stick. Abba. For today, we finished. So thank you all, wonderful guys, for coming to the class, spending every day 2 hours with the teacher and inspiring him to study along with you. We'll all see you tomorrow, sharp 2 o'clock.
No, afternoon they had food and went. Okay, I finished eating by 1:45. They had food at 2:30. Until 1:30 outside.
Good night, sir.
Good night, sir.
Take care.